In Northern California, community health centers do more than provide care. We keep small towns running. We serve working families, veterans, and seniors right where they live. We're part of the fabric of rural life, trusted by our neighbors and built to meet local needs. But that care is at risk.
So HANC is a network of community health centers across a 9-county region in Northern California, and we exist to support the health centers in fulfilling their missions of providing physical, behavioral, and dental care to everyone, regardless of their ability to pay. In 2024, our member health centers saw 93,609 patients. So it's a large number of people across a huge geographic area.
The community health centers are the backbone to the healthcare network and health systems. Without us being available for patients, there really is not a lot of options for them, and a lot of them don't go and seek care otherwise unless there is an access point in their community.
Medicaid funding is the primary source of funding that we have at Shasta Community Health Center. The different resources that we have available for our patients, those are all tied into the way that we are reimbursed through that Medicaid pathway. The percentage of patients that we see here that are on Medicaid, or in other words Medi-Cal in the state of California, is really just under around 70%. That's specifically for our medical services. If you look at our dental services that we provide for the Medicaid population as well, we're closer to mid-90s. And so there's a lot of patients who we serve who rely on Medicaid.
It's vital to our patients and vital to our clinic because we are the primary provider for our Medicaid recipients in the county. We are able to provide a lot of very essential services, from our walk-in clinic to primary care to dental, behavioral health, women's, and OB. And we are also able to provide services such as health education, things like smoking cessation, diabetes management, and birthing classes as well.
You know, it's important to realize that the patients who we serve, they're coming to the table with all sorts of unique challenges. They're coming from all sorts of walks of life. They may have addictions. They may have just an extreme lack of access to resources, funding. And so we use those Medicaid dollars to cover all sorts of services to help connect them to what they need.
The Medi-Cal dollars really help offset too some of the costs that people don't really want to hear about. But for Mountain Valley's health centers, we have our worst payer is private health insurance. And so when we don't have reimbursement for private health insurance, Medi-Cal often closes that gap for us to allow programs for all of our patients.
In Round Mountain, California, where our primary clinic site is, we are the largest employer. So if our clinic resources, revenue, financial access to financial resources is cut, then we're forced to be put in a position to reduce the opportunities to work, the jobs. It would devastate this rural community in terms of opportunities for employment and growth and career opportunities. It would be devastating.
Cutting Medicaid would be economically devastating to all of our states. It would create massive amount of people in our emergency rooms. People would not be able to get the care they needed with access being cut. They would not be able to work and therefore not be able to pay taxes. It would just all around be horrific.
Health centers like ours are a pivotal piece of the healthcare in our local communities. And with that cuts to already strained systems such as ours that have needed to meet things like massive inflation, increasing costs of everything, including staffing. It has already been where we need to cut for ourselves. Any further cuts that might be to the funding that we receive to actually care for our patients would be a reason that we may have to close our doors.
Whether we're in a city of 90,000 or in a town of 300.
We are community health.
We are rural health.
We don't ask for a handout.
We ask for the tools to do what we've always done, take care of our own.
Cutting Medicaid threatens jobs, safety, and access to care across our regions.
Protect the health of our communities and the people who call them home.